I want to bring in Trump's former CDC director, Dr. Robert Redfield, former White House COVID coordinator for the Biden administration, Dr. Ashish Jha. Both are friends of mine who helped me in times sick and well. Love you both. Thank you for being here. Bob Redfield, let's do staffing and then we'll do COVID. Let's try to bang through them. On the staffing side, those who are concerned about this and it shows a radical shift, what do you say to them, Bob?
Well, I think, Chris, it's important that the reality is the secretary has to have people in leading these agencies that he has confidence in and he feels that are supporting his agenda. And unfortunately, even though I have a lot of respect for Susan, I think they got in a situation where it was not viewed that she was supportive of the secretary's agenda. Obviously, changing CDC is a really important thing. I believe it needs to get back to its primary mission of being a public health response agency. And I think Kennedy is on a path to try to accomplish that. But it's caused a lot of dissatisfaction among a number of the traditional CDC employees who've been there for the last 20 to 30 years.
So, Ashish, you've gone through the political hurdles. You know what it is to be part of a team and what has to be a crisis of conscience. What do you think of this move, and what is the right way for people to analyze it?
Yeah. Well, first of all, Chris, thanks for having me back. And I suspect Bob and I agree on the need to reform CDC. It is urgently needed. But let's get some facts clear. Susan Monarez, Secretary Kennedy nominated her 2 months ago. This was his person. He nominated her. She went through the Senate confirmation process. And then let's also talk about why she was fired. Was she fired because she's an old guard, old CDC person? No. She was fired because he said to her, whatever the evidence shows, I need you to back me on vaccines, and I need you to back me on my political agenda. And even though she's his pick, she said, I can't do that. I got to look at the data. I got to look at the evidence. And that's why she got fired. So this is not about cleaning house. This is his pick. He picked her. And she got fired because she refused to go along with a political agenda. She said, I'm going to rely on data and evidence. Those are the facts, Chris. And that's what we have to grapple with. And that's what makes this so troubling.
I have one question. We've all been through this process before. Don't you think they would have had that conversation before he put her up for the job, Ashish?
Yes, that's the problem. Like the president 3 months ago.
So you think she went bad on him?
No.
You know what I'm saying? Like if I say to you, you with me? And you say, yeah. And then later on you say, I can't do that. You think that could have happened?
Yeah. So first of all, I mean, the president tweeted about how wonderful she is and how committed she is. She is wonderful. She is committed. I suspect what happened was he basically said to her, probably 3 months ago, hey, if the data shows that vaccines are harmful, are you going to be with me? And she probably said, yeah, I'm going to go with where the data goes. Unfortunately, the data don't seem to align very well with where Secretary Kennedy is. And he asked her for loyalty over truth, and she picked truth over loyalty. You would have thought that truth 3 months ago.
Let me get a quick take from each of you. Dusty, just give me a little bit more time. The news that just came out about the COVID vaccines, I just explained to the audience the way I understand it, which is that the government, Bob, is saying that it's not automatic for as many people. You can still get it, but we're not going to make it a must for as many people, which will satisfy certain of vaccine critics, but may also make it harder for people who want it to get it because the insurers may not pick it up the same way if you're not in one of the preferred groups. Are you okay with this, Bob?
Yeah, I think that you have to look at the data. Again, going back to what my colleague said. And the data is that these vaccines do not prevent infection. And the data shows that where they have benefit on clinical disease is those individuals that are at risk for bad clinical outcome. And those are disproportionately people over the age of 65 or people with significant comorbidities. And so I think the revision of the recommendations that the FDA has come up with, the new approvals that they just came out with a couple of days ago, is these vaccines, the new vaccines are recommended for people over 65 or people who are under 65 that have a significant comorbidity. If for the, I think Pfizer, it was if you're greater than 5 years of age to 65, and for Moderna, I think it was
Right.
greater than 6 months. So I think I'm very comfortable. These vaccines really never belong to being routinely utilized in the broader population.
Ashish?
Yeah, look, I'm pretty close to Bob on this, but I have a slight disagreement, which is, so I think what Bob said is largely right. Here's the problem: if you're a 62-year-old person and you want to get the COVID vaccine, do I think the COVID vaccine is going to probably be beneficial to you at 62? It probably is. And I wish, instead of coming out with recommendations, first of all, there are no mandates. Nobody needs to get these vaccines. But I wish that the CDC and the FDA had basically said, these are our most highly recommended groups, but everybody else can get them and insurance will cover it. By taking that away, you really are reducing choice. We should be promoting more choice and more freedom at this moment, not making it hard for a 62-year-old who wants to get the COVID vaccine not to be able to get it or have to pay a lot out of pocket. So that's the place where I think I disagree with where the FDA is, but largely I think the clinical stuff here is exactly as Bob said.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.